What organ of the lymphatic system is the site of T-cell maturation? A. The thymus. B. The spleen. C. The cisterna chyli. D. The lymph nodes. The answer is A. The thymus. T-cell maturation occurs in the thymus, a small organ located in the upper part of the mediastinum, between the heart and the sternum. Mature T cells then may either circulate in the lymph or blood or reside in lymph nodes. The spleen is not a site of T cell maturation, though it does have other important immune functions, such as the production of antibodies and the removal of antibody-coated pathogens. The cisterna chyli is a part of the lymphatic system that is involved in lipodigestion. Digestive fat is absorbed through what specialized lymphatic vessels of the small intestine? A. Villi. B. The cisterna chyli. C. Lacteals. D. Microvilli. The answer is C. Lacteals. Dietary fat is absorbed via lacteals, small lymph vessels contained within the body of the intestinal villi. Microvilli, tiny projections covering the surface of the villi, help with the absorption of minerals, vitamins, and other micronutrients. The cisterna chyli is a dilated pouch at the lower end of the thoracic duct that serves as a collection point for fatty chyle from the intestinal lacteals. Which of the following is not a function of the lymphatic system? A. Absorption and transportation of dietary fats. B. Lymphocyte transport and activation. C. Secondary gas exchange. D. Draining of interstitial fluid from tissues. The answer is C. Secondary gas exchange. The lymphatic system has several roles in the body, including drainage of interstitial fluid from tissues, transportation and activation of lymphocytes, and absorption and transportation of dietary fats. Red blood cells, however, are unable to enter lymph vessels, and so the lymphatic system does not participate in any type of gas exchange. When drawing blood, the client tells the nurse that she is a universal recipient. The nurse knows this to mean that the patient has which type of blood? A. O negative. B. AB negative. C. A positive. D. AB positive. The answer is D. AB positive. AB positive is a universal recipient, meaning a patient with AB positive type blood can receive a blood transfusion using any type of blood. Every Hem group in hemoglobin encloses an atom of what element? A. Magnesium. B. Chromium. C. Copper. D. Iron. The answer is D. Iron. Each Hem group in hemoglobin encloses a single iron atom in the center of a protoporphyrin, a tetrapyrrole composed of 4 pyrrolyl rings linked together by 4 methyl groups, 2 vinyl groups, a methane bridge, and 2 propanoic acid side chains. What is the average lifespan of an erythrocyte? A. 4 months. B. 6 weeks. C. 6 months. D. 3 months. The answer is A. 4 months. The average lifespan of a red blood cell is 4 months, after which it is phagocytosed by macrophages, the spleen, liver, or lymph nodes. White blood cells, on the other hand, live for only about 3-4 days. What hormone stimulates the casting of new red blood cells? A. Luteinizing hormone. B. Vasopressin. C. Erythropoietin. D. Thyroxine. The answer is C. Erythropoietin. The casting of new red blood cells is stimulated by the hormone erythropoietin, EPO, released from the kidneys. Recall that all blood cells are made in the bone marrow. This hormone may increase as much as 1,000-fold in times of oxidative stress. Thyroxine is T4, the most biologically active form of thyroid hormone. Vasopressin, or antidiuretic hormone, is part of the body's fluid balance system. Luteinizing hormone is a hormone of the reproductive tract. In females it triggers ovulation, while in males it stimulates Leydig cells to produce testosterone. Where is erythropoietin produced? A. Peritubular interstitial cells of the kidney. B. Lactotroph cells in the pituitary gland. C. Zona fasciculata cells of the adrenal glands. D. Supraoptic and paraventricular cells of the hypothalamus. The answer is A. Peritubular interstitial cells of the kidney. Erythropoietin is produced by the peritubular interstitial cells of the kidney. These cells are very sensitive to tissue oxygen pressure. When oxygen demand increases, erythropoietin is released, stimulating the casting, hematopoiesis, of new red blood cells in bone marrow. Supraoptic and paraventricular cells of the hypothalamus are the site of vasopressin, antidiuretic hormone, production. Lactotroph cells in the pituitary gland are responsible for the production of prolactin. Zona fasciculata cells of the adrenal glands produce cortisol. Neutrophils make up what percent of white blood cells in the blood? A. 20 to 35%. B. 55 to 70%. C. 70 to 90%. D. 2 to 6%. The answer is B. 55 to 70%. Neutrophils are the most common type of white blood cell, making up 55 to 70% of the total white blood cell population in the average blood sample. Eosinophils make up what percent of the average white blood cell count? A. 5 to 15%. B. 1 to 3%. C. Less than 1%. D. 20 to 40%. The answer is B. 1 to 3%. Eosinophils are the leukocytes that are largely responsible for response to parasitic infections and allergies. They make up 1 to 3% of the average white blood cell count. They form the second smallest population of white blood cells, after basophils, which normally make up less than 1% of white blood cells in whole blood. Monocytes make up what percent of the average white blood cell count? A. Less than 1%. B. 2 to 10%. C. 26 to 33%. D. 55 to 70%. The answer is B. 2 to 10%. Monocytes, the largest of all the leukocytes, make up just 2 to 10% of the average white blood cell count. These white blood cells will mature into macrophages to phagocytose foreign matter. Monocytes make up what percent of the average white blood cell count? A. Less than 1%. B. 2 to 10%. C. 26 to 33%. D. 55 to 70%. The answer is B. 2 to 10%. Monocytes, the largest of all the leukocytes, make up just 2 to 10% of the average white blood cell count. These white blood cells will mature into macrophages to phagocytose foreign matter. What is the role of platelets in the blood? A. Gas exchange. B. Cytotoxicity. C. Clotting. D. Histamine release. The answer is C. Clotting. Platelets are small cell fragments that play an important role in hemostasis, or clot formation. Once activated, platelets release clotting factors that recruit more platelets till a clot is formed and bleeding stops. The process by which white blood cells move into and out of blood vessels is dash. A. Phagocytosis. B. Diapedesis. C. Granulocytosis. D. Endocytosis. The answer is B. Diapedesis. Diapedesis, also known as leukocyte extravasation, is the process by which white blood cells move into and out of blood vessels. This process includes 4 stages: chemotraction, rolling adhesion, tight adhesion, and endothelial transmigration. This process is integral in the delivery of white blood cells to sites of infection and in their return into the bloodstream to mobilize and facilitate the excretion of waste. All of the following white blood cells are granulocytes except dash. A. Monocytes. B. Basophils. C. Neutrophils. D. Eosinophils. The answer is A. Monocytes. Neutrophils, eosinophils, and basophils are all granulocytes, meaning they contain visible granules within their cytoplasms. These granules contain acids and antimicrobial enzymes, and are released at the site of infection. Monocytes and lymphocytes are granulocytes, meaning they do not contain granules in their cytoplasm but rather destroy foreign proteins by other means, such as phagocytosis and cytotoxicity. Platelets are derived from what parent cell? A. Plasma cells. B. Megakaryocytes. C. Erythrocytes. D. Progranulocytes. The answer is B. Megakaryocytes. Platelets are derived from megakaryocytes, cells produced in bone marrow, kidney, liver, and spleen, with large, lobed nuclei. Platelets are formed within the cell and then released into plasma. Erythrocytes, mature red blood cells, plasma cells, a type of B cell, and progranulocytes, precursors to neutrophils, basophils, and eosinophils, take no part in the creation of platelets, which are fragments of cells, not whole cells. What is the average amount of blood in the adult body? A. 3.5 to 5.5 liters. B. 6 to 7.5 liters. C. 4.5 to 6 liters. D. 7.5 to 9 liters. The answer is C. 4.5 to 6 liters. The average adult body contains 4.5 to 6 liters of blood, depending on size and gender. Blood volume, BV, can be calculated by the following formula, given the hematocrit, HC, and plasma volume, PV. BV equals PV divided by 1 minus HC. The most common free plasma proteins include all of the following except dash. A. Globulin. B. Major histocompatibility complex, MHC. C. Albumin. D. Fibrinogen. The answer is B. Major histocompatibility complex, MHC. The three main types of proteins in the blood are albumin, globulin, and fibrinogen. Major histocompatibility complex is not a free plasma protein, but rather a class of proteins found on the surface of all nucleated cells, MHC class I, and on the surface of certain immune cells known as antigen-presenting cells, MHC class II. They play an important part in immune function by displaying foreign antigens for communication between leukocytes. Lymphocytes, natural killer cells, T helper cells, and B cells, make up what percentage of white blood cells? A. 55 to 70%. B. 1 to 3%. C. 26 to 33%. D. 5 to 15%. The answer is C. 26 to 33%. Lymphocytes are the second most common class of white blood cells, making up 26 to 33% of white blood cells. Which of the following blood cells is anucleate, lacking a nucleus? A. Natural killer cells. B. Dendritic cells. C. Megakaryocytes. D. Erythrocytes. The answer is D. Erythrocytes. The only anucleate blood cells are erythrocytes, or red blood cells. These cells are created with nuclei, but each daughter cell will then lose its nucleus in order to create more surface area for hemoglobin to bind oxygen and for easier passage through narrow capillaries. The nurse cares for a patient hospitalized for 5 days with pneumonia. He is about to be discharged and the nurse is providing discharge instructions to the patient and the family. Which statement made by the patient's family should most concern the nurse? A. He can stop taking the antibiotics when the symptoms are gone. B. He still has to use the incentive spirometer to keep his airways clear and open. C. He can eat normally but we have to make sure he has a nutritious diet. D. He can start doing his chores when he feels better, but shouldn't overexert himself and should rest a lot. E. He should stay away from other sick people because his immune system is still weak. The answer is A. He can stop taking the antibiotics when the symptoms are gone. When a patient has an infection and is prescribed antibiotics, the patient should always take the full course of the medication and never discontinue the medication. It is easy for patients to believe they can stop taking the medication when the symptoms are resolved, but the nurse needs to educate the patient to continue the full regimen. The rest of the statements are accurate. The patient must get adequate rest, eat well, use the incentive spirometer, and stay away from others who are sick until he is well. A 2 plus radial pulse is considered to be dash. A. A normal pulse. B. A bounding pulse. C. An absent pulse. D. A weak pulse. The answer is A. A normal pulse. The following scale applies to the amplitude of a pulse when palpated at the radial artery. 3 plus is an increased or bounding pulse, 2 plus is a normal pulse, 1 plus is a weak pulse, 0 is an absent pulse. Which of the following locations is most appropriate for assessing the pulse of an infant? A. Carotid artery. B. Brachial artery. C. Radial artery. D. Popliteal artery. The answer is B. Brachial artery. The most appropriate location for assessing the pulse of an infant is the brachial artery, which travels from the axilla down the ventral surface of the upper arm to the cubital fossa. The popliteal and radial pulses are difficult to palpate on an infant due to their size, and the carotid artery can be difficult to palpate due to an infant's shorter, thicker neck. Which of the following is a normal adult respiratory rate? A. 11 breaths per minute. B. 9 breaths per minute. C. 16 breaths per minute. D. 22 breaths per minute. The answer is C. 16 breaths per minute. Normal adult respiratory rate is 12 to 20 breaths per minute. A respiratory rate below 12 is defined as bradypnea, while a respiratory rate above 20 is considered tachypnea. What is a normal respiratory rate for an infant under 1 year of age? A. 30 to 60 breaths per minute. B. 20 to 30 breaths per minute. C. 10 to 20 breaths per minute. D. 60 to 90 breaths per minute. The answer is A. 30 to 60 breaths per minute. Infants have the highest respiratory rate of any age group. A normal infant respiratory rate is 30 to 60 breaths per minute.